Good morning and welcome to the whole Cranley community. My name is Liz Hewitt and I am Director of Wellbeing here at Cranley in Abu Dhabi. This is the second of this year's Cranley Community Connects talks, and we will be joined together today by Ms. Tori Blackadder, who is our school counsellor. So these sessions give us an opportunity to come together as a community, to collaborate and to discuss topics that we are all interested in. Today we will be unpacking the topic of how to support our children's mental health. Now, this is a very delicate but also a vital issue, particularly at the moment. A recent survey from the National Health Service in the UK showed that since 2017, 39% of 6 to 16-year-olds have experienced a deterioration in their mental health. Among 17 to 23-year-olds, this rose to 53%. The proportion of young people with eating disorders has also doubled in basically the time since 2017. These are worrying statistics, and they're being seen in schools the world over. Let's be honest, it can be really scary to talk about our own mental health, never mind that of our children. Our own fears and experiences can cloud how open we feel we can be. And we don't want our children to be mentally ill in any way. But talking about something is not going to make it happen. In fact, when we talk about our feelings, they become less overwhelming and less upsetting, and we are better able to cope. We are our children's first role models in life. And so it's important that we feel safe to be able to discuss issues around mental health and to normalise those conversations, just as we do about physical health, without shame and without stigma. The global pandemic is still ongoing, but many aspects of our lives have now become normal again. Unfortunately, many of us do not feel the same sense of normal that we felt before the pandemic hit. We may be grieving for things that we lost, whether that's people, experiences, or time. And as we adjust back into our daily lives, here at Cranley, we have put our children's mental health first. We have had many of our children trained as mental health first aiders. In fact, all of our years 7 to 11 last year were trained with a bespoke 90-minute session that they did about mental health. We have 14 of our senior school pupils who are fully trained as mental health first aiders, and we have over 40 of our staff who are also mental health first aid trained. As we move into next term, we will be training many of our staff in suicide first aid training so that we're ready, we're prepared, and we're trained no matter what issues are in our community. So why do we do this? We do it so that we are aware of what are the signs to be looking out for and what we can do to help when our children are struggling. The support for our students in school starts firstly with their tutor, the person who sees them every single day. But of course, our families will be the most important source of support. Hence why we wanted to introduce ourselves today and to explain a little bit more about what we do in school. There will be opportunities as we go through today to ask questions as we go along. But if you do not feel comfortable putting questions on the YouTube chat or in the Facebook chat, we totally understand. So please do drop me an email and I will be checking my emails as we are live. So I would like to introduce Tori into our session today. Tori is our new school counsellor, so I'm going to welcome her into the session. Grab yourself your coffee, and I hope that we answer some of the questions that you may have. Welcome, Tori. Good morning.
Good morning, and thank you for the introduction there. Just let me share my screen here.
Today, Tori is going to be going through a few of the questions that have already come in, and she's going to be introducing lots of different things that we're seeing in school. What I will say is that around 70% of all of the issues that we're seeing in school currently are related to anxiety. So Tori has dealt with that And hopefully we'll be able to give you some tips on what to do if your child is struggling with that and with many other of the issues that we're seeing. So I will hand over to her and I will be back. But if you do have any questions, my email is there on the bottom of the slide. So please feel free to drop me an email. Thank you.
Thank you. Right, I've got that sorted now. So again, thank you all for joining us on this live stream and for those watching it at a later date. Like Ms. Hewitt mentioned, today we're going to be talking about supporting your child's mental health and some common mental health issues that we see in school and how they're presented. I'd like to just start by introducing myself with a little bit about me. I feel that for students to be able to share their struggles and share with me their personal stories, it should be expected that they know a bit about who I am as well, and that applies for you as parents. A little bit of my background, if I may, is that I grew up overseas. So like many of our students here, I'm what's known as a third cultured child. So where you're raised in a culture or environment that is different from that of your parents. I'm going to be honest and say that it was hard. It definitely had its challenges. And in fact, it was some of those struggles that I faced in school to be what led me to pursue a career in school counselling. Some of the difficulties that I faced and that are common with our students now are that they leave their home, they struggle to fit in, they deal with cultural differences, they feel left out during summer holidays when they go back home. And I understand that that has an impact on our children, and I understand and can relate to what that feels like. Eventually, I returned to the UK, where I'm from, to complete my further education. I gained work experience within local authorities in London, and that was in clinical, community, and educational settings. I think the international upbringing must have played with me a little bit because, funny enough, I went back to where I was raised and worked as a school counsellor there. Eventually, I continued my travels to Qatar, where I gained my first experience within the Middle East. And I can certainly say that it had its challenges, and some limitations are similar to those here in the UAE. But being in an international school setting, like what I was exposed to growing up, is where I'm happy. So, as you can see on the presentation there, some of the issues that we'll be discussing today are anxiety, depression, eating disorders, self-harm, factors that affect our mental health. We will also look at what is counselling and some tips for effective communication. So if I can start off with anxiety. We will be looking at what it is and some ways in which it's presented in school. In particular, we'll be discussing social issues such as masks and eating problems. We'll look at social anxiety, separation anxiety and school refusal, panic disorder, OCD, signs and symptoms of each of these, what parents can do to support, and we'll have some questions at the end of each topic. So, to start with anxiety, it is our body's natural response to stress. It comes back to our built-in survival mechanism known as the fight, flight, or freeze response. And that's there to prepare our body to fight off a threat, escape quickly, or freeze and hide. So the way in which it works is obviously, if we look at our anatomy, the amygdala part of our brain senses that potential threat. That sends off alarm bells. So our body goes into one of the mentioned modes above. It's sort of like a smoke alarm. So it can go off when there is a fire, absolutely. But it can also go off when someone is burning toast. So to understand that is that anxiety can get triggered when we're not really in danger. Some signs and symptoms of anxiety is that we have feelings of worry, nervousness, apprehension, Physical sensations, which cover sweating, increased heart rate, or trembling. Quite often we avoid certain situations that trigger our anxiety, and we have trouble concentrating. So ways in which anxiety is being presented in school are, one of them, as you can see on the screen here, is hiding behind masks. And this is something that we actually see across all of our age groups, from the younger ones in pre-prep to our older students in sixth form. So I think part of the reason we have this issue now is because, if I can introduce you to the term social referencing. So this is developed by picking up facial expressions and cues. These rely on, or these guide us how to respond towards people in new situations. And with the pandemic that has been going on for the last 18 months, we may not have yet learned these skills. So we find it easier to avoid the situation and hide behind the mask. I think it can also be developmentally confusing, particularly with our younger children, as they have been told to wear a mask to protect them from an invisible threat. And I think that in itself is quite confusing to grasp at a younger age. We also see social issues being presented as difficulty eating. So in my opinion, this could be a result of not having the opportunity to eat in public for over a year. We haven't had restaurants open, we haven't been going to malls, we haven't been eating in front of others outside of our home. Now, it's not necessarily the fear of eating food itself, but rather the feeling that others are judging us whilst we are eating. I'd like to just mention that this is not an eating disorder on its own. However, it is definitely worth keeping a close eye on. If we now look at social anxiety and separation anxiety, we are seeing a lot of poor peer relationships. I believe that this is due to a lack of social interactions. Children have missed out on learning valuable skills by spending so much time in isolation and quarantine. Younger children who are now suddenly in year 1 may not have learned the skills they learned in FS2, such as how to share. Our year 8 students who missed out on important peer relationships and during those developmental years are now transitioned into senior school and are developed teenagers. Those without siblings may have had no other engagement with other children, and those isolating may not have seen groups of people for a while. So with this, we are seeing conflicts between peers as young people find their place within their friendship groups, and they're becoming more acquainted with these skills. Another contributing factor to poor peer relationships could be that fear of judgment. And again, this is as a result of not having to worry about people's opinions as much over the last 18 months. We have students who are experiencing anxiety when faced to do things that they haven't had to do recently, really. This includes things like presentations in class, or being in group settings, or engaging with peers. Of course, we also have separation anxiety and school refusal. I'm sure many of us as adults experience this when returning face-to-face to work as well. And our children have gone through having the comfort in their own home, having their parents and family around them 24/7. They are now being set off into the real world, which is very much unknown due to having no sense of familiarity. We are seeing young students being clingy to parents, and that's because the idea of being away from them and the familiarity that they know can be scary. If you are experiencing this within your family, I'd just like you to know that, firstly, it is developmentally normal for children to experience this. It means they love you, and simply that they would rather be spending the time with you instead of going somewhere else. Similarly, in our older students, there seems to be more avoidant behaviours, so such as feeling sick, or asking to go to the nurse's office, the clinic, trying to get out of coming to school. To help these issues, again, try validate. support and encourage. And one tip that's usually quite helpful in these particular situations is to try create a bit of time at the start of your day to spend with them, just to give them that reassurance and safety that they need. I'll now touch on panic disorder. So panic disorder is intense feelings of fear when there is no real danger. They can appear at random, or they may have particular triggers. So you can see here, we've got some of the symptoms for panic disorder. And these physical responses include feeling nauseous. You may feel your heart pounding. You might feel shaky or have shortness of breath. So with panic attacks, it is always best to remember that prevention is better than cure. So by becoming familiar with the onset of a panic attack, we can treat the leading anxiety rather than the overwhelming sensations that we are experiencing in that moment. The next topic of anxiety I'm going to discuss is OCD, so obsessive compulsive disorder. This is when people have recurrent unwanted thoughts that make them feel driven to do compulsive, repetitive behaviors. It is with the belief that if they do not carry out the compulsive behaviors, then something terrible will happen. I often hear people say, even adults, "Oh, I'm so OCD," as they like things done in a particular way, or they have habits that they feel they cannot shake, and they just call it OCD. However, what differentiates OCD is the intrusive thoughts that are associated by not carrying out the ritual, not carrying out those compulsive behaviors. Habits, of course, they do make us feel uncomfortable sometimes when we don't do them, but it's the negative thoughts with OCD, and they are usually much more sinister. I'm now going to talk about some support strategies that you as parents can offer your children if they are experiencing levels of anxiety. So firstly, I would advise to attempt to build confidence in your children. This will support them in a huge range of social situations as they learn that they are able to do the task at hand and there's nothing to fear. So provide them with the opportunities to learn new skills, and that being said, also let them excel in the current ones to give them that boost of self-esteem. If we do something we know we're good at, we feel a sense of pride. Other ways confidence can be built includes providing them with opportunities to take risks and gain independence. So this includes simple things like letting them serve themselves at breakfast, or helping in the supermarkets, or sending our older children down to the supermarket to buy some milk. There's so many opportunities around us to nurture independence, which will allow confidence to grow. Another strategy that we can use when dealing with anxiety is reframing our thoughts. So when we see a situation as a threat, we get anxious. However, when we see a challenge that we can accomplish, we get excited. So when you're faced with anxiety, think to yourself, how can we reframe the situation as a challenge that we can move through? And of course, remind ourselves that increased stress is there to help us perform our best. Having a little bit of stress in our life is quite motivating. It pushes us to try and go a little bit further. I'd also like to suggest encouraging our children to face the challenge when they are experiencing anxiety. As parents, it's always very easy for us to want to protect our children. However, I would advise to not shield them from all situations. Rather than using our avoidant behaviors, which will only reinforce the anxiety, they will never learn how to cope in these difficult situations. With a lot of anxiety, one way to overcome it is by gradually tackling the problem. So taking smaller steps to get to the ultimate goal. So for example, this might look like if you have anxiety when giving presentations, then start by presenting at home and then in front of one friend, then in an empty classroom, gradually to a teacher, and then a small group of friends, and so forth. Of course, we can always practice strategies to calm down our anxiety as well if we are ever finding ourselves in that moment. So consider coping strategies like mindfulness or deep breathing. And again, these can be adapted for all ages, such as belly breathing, which we do with some of our younger children, to full body relaxation techniques for those who are more in tune with their bodies. Of course, if we help them identify when they are becoming overwhelmed and go over strategies that they can use to prevent the situation from escalating. There's a range of YouTube videos to books that are suitable for all ages to guide through this and can give some guidance on mindfulness and deep breathing. It's also important to reward small steps. Overcoming anxiety isn't something that is going to be done in a short period of time. We might not see those huge changes for weeks or months. However, reward all the small steps that are taken. So give verbal praise, acknowledge their efforts, treat them, provide immediate rewards. Small steps over time will create change. However, we just need to remind ourselves to be patient and support them along the journey. Something that we can do as parents to help our children is to model appropriate behavior. So this includes asking appropriate questions, so allowing them to partake in communication and practice social skills. For example, if we have a child who has anxiety speaking in public, you could say, look, Mama's going to ask the waiter for some more water. By modeling the communication and then talking to your child afterwards about what happened, it will allow them to see and understand that the task was accomplishable and that nothing bad happened. So use yourself as a role model. You can see at the bottom of this slide here, we have Miss Hewitt's email address. So her email address is scattered around throughout the presentation. So please do email her any questions. You can also use the live chats as well. I've now come to an end of our topic on anxiety. So if you have any questions in particular about anxiety, then please do feel free to let me know now.
Hi, Tori.
Hi.
Just had a quick question in. Could you explain why so many people are having OCD-like thoughts at the moment?
Yep, certainly. So I think given that we are encouraging our children to wash their hands for 20 seconds multiple times a day, it is becoming a habit that is instilled in our children. I still sometimes think it's quite crazy that our youngest 3-year-olds in FS1 have hand sanitizer as a word in their vocabulary.
Yeah, absolutely.
So it's certainly something that we are seeing more frequently. However, just to reiterate what I said about OCD, what differentiates OCD and habits is those intrusive thoughts that something terrible will happen if they don't carry out those repetitive or compulsive behaviors. If we do see that our child is asking to, for example, wash their hands outside the expected times, so normally it's before we eat, after we go to the restroom, after we've had some playtime. If your child is asking to wash their hands a little bit more unusual times, and you can sense that they are worried that they don't wash their hands, then I think that's maybe the point where you consult a professional and they can do further assessments.
And a question as well on the chat. How do you deal with anxiety before exams? I know this is a huge area, and I know you did deliver something on this for parents as well, on some of the parents' evenings, but how exactly do we deal with that, especially for our Year 11s coming up to their GCSE exams, and our Year 13s who will be sitting exams really for the first time because of the pandemic as well?
Yeah, well, thank you for the question. It's definitely something we are seeing at the moment, as I know a lot of our year groups do have the end of unit exams at the moment, and certainly the more bigger GCSEs and A levels coming as well. With anxiety, like I mentioned, it's always better to work with the prevention rather than cure. So by being able to adopt practices in our everyday life to put us in a better mindset can help reduce the anxiety when we are faced in those more challenging or stressful situations. So this can include doing mindfulness, practicing our breathing. It can also cover a range of strategies, for example, finding the most optimum situation for you to perform in those tests. So you might find it very helpful if you have a little fidget toy whilst you're doing your exam. You may find it better if you're sat at a certain angle. There's definitely strategies that students can practice to help reduce their anxiety. And again, talking to their teachers as well. Obviously, our teachers are a huge resource. And if there's any anxiety related to the subject at hand, then perhaps the teacher can offer some support there as well.
Okay, so it's a case of prevention being better than cure. I think it's practicing, isn't it, before they get to the exam, what they can do and what techniques they have.
Absolutely.
Perfect. Thank you. I will let you continue. Thank you very much.
So we are now moving on to our next topic, which is depression. So again, we'll go over what it is and how it presents in school. We'll look at what parents can do to support, and we'll have our questions again. Now, I just have a little quote here, and this is by a psychiatrist at Waste Memorial Hospital in the States. He says, "Depression is a cruel disease that can affect anyone. It's very easy that once the symptoms begin for a person to slide down the black hole of depression, where symptoms spiral and feed off each other, increasing in severity." So again, this goes back to catching things early on and trying to work with prevention rather than cure. So depression is a constant feeling of sadness and emptiness. What differentiates depression from low mood and feeling sad is that depression is consistent and affects our day-to-day abilities. Some signs and symptoms that we can look out for when looking out for depression is that constant feeling of low mood. And this can be shown as being tearful, but again, not always being tearful. It's often accompanied with feelings of hopelessness as well. People who are experiencing depression may have little interest in activities. So including the ones that used to bring them joy, they may have stopped doing their favorite hobbies or engaging in things that they used to do in their spare time. We may also see a change in their sleep pattern, and this can come in a number of ways. So it may be that they are sleeping too much. It could be that they are having a hard time falling asleep, or when they are asleep, it's very disturbed at night. And another sign is changing eating habits. And like sleeping, this can manifest itself in different ways. So overeating or poor appetite or having the desire to eat more comfort food. Some ways in which parents can support children who are experiencing depression is firstly motivating them, to encourage motivation. Encourage your child to engage in activities that you know they used to enjoy. We've probably all been there ourselves. We aren't in the mood to go out and see our friends, but if our partner dragged us out, I'm sure that once you were there and afterwards, you were probably quite glad you went. So do sign your children up for classes you know they'll enjoy. Get them involved in an activity they like. They'll need encouragement from us to engage at the beginning. And I know that perhaps with some of our older students, our teenagers, we might feel some resistance and they'll be reluctant to go. However, with that gentle encouragement, hopefully once they're engaged, it will be easier from there. Another support strategy that is quite effective at dealing with depression is behavioral activation. So this is a technique based on the assumption that low mood is from lack of positive reinforcement. So they therefore might engage in unhealthy habits such as sleeping in the afternoon, taking long naps, not going out with friends, not bothering exercising. In behavioral activation, you outline the goals that you want to accomplish that are in line with the life that you want to live. So this includes having a planner and allocating times to do these things that may bring simple joy, and to have those positive activities incorporated as part of your daily life. Another helpful approach is to express gratitude. People who regularly express gratitude for the positive things in their life are shown to be happier overall, leading to lower rates of stress and depression. Showing gratitude can certainly make us more optimistic. I know that firsthand. And so try and incorporate this into a daily practice at home while you're having dinner or whilst you're in the car doing the school run. Ask what they're thankful for. Say what you're thankful for. Another good strategy to practice, of course, is showing them that you care. And this is verbally and otherwise. It's very easy for people experiencing depression to feel unloved. And there's lots of ways that you can show you care. So this includes compassionate listening skills, reassuring touches, cuddles, small acts of kindness. I often have students in my office and they say, I know my parents care. They feed me, they give me a good education. But a meaningful I love you or a thoughtful gesture can really boost their mood. And they've told me this. My last piece of advice for supporting those who have depression is to focus on the here and now. So if you're experiencing a negative feeling that you don't want to have, think of it like a game of tug of war. So opposite you have a monster and all the negative feelings you don't want. And in between you both, you have a pit. So you might think that if you fight hard enough and keep battling, that monster will fall into the pit and disappear forever. But no matter how hard you try, you can't defeat it. So it's exhausting and it might make you feel like you're getting nowhere and that the monster is pulling you closer into the pit. So by focusing on the here and now, if we think, what if we were to let go of that rope and focus on the things that matter most? So those negative feelings may still be there, but you're not as exhausted trying to control them. And more importantly, they can't control you. So if you focus on the here and now and take time to let yourself engage in the simple things that can bring you joy, it will allow you to have that more positive look in things. Lastly, of course, with depression and anxiety is communication. Communicate with your children if you do think they are struggling. Towards the end of the presentation, I will go over some advice on communicating with your children as well. If we had any questions to do with depression before I move on to eating disorders, Mrs. Hewitt, please do let me know and I'll be happy to address them now.
We don't have any about depression specifically, but we do have one about children listening. And I know you're going to tackle this, as you said, but how my child doesn't listen to me. what can I do about this? How do I try and improve that communication?
Yeah. So I sometimes encounter this myself. I'm not always blessed with students opening up to me at first. I'm new to this school. I'm a stranger to many of them. So I always have to adapt my approach when communicating with them. It's finding a strategy that works best for that child, because there is no one fits all answer for this. So ways in which I adapt my approach is and perhaps you can do this in your home as well, is try to talk to your child in different settings. So this could be when you're doing the school run and they're sat in the back of the car, and a parent actually told me this, that their child was more willing to open up because the child didn't have to speak to their parent face to face. Other things can be whilst you're having a kick around with the football outside, try and engage in the conversation then. It's all about finding the right environment and adapting strategies to open that communication pathway. Try not to be too disheartened when they say, I don't want to talk about it, nothing's wrong. Do gently encourage communication. It is important. And like you said, please just stay tuned towards the end of the slide where I'll go over some more strategies for effective communication.
It sounds like you're saying it should be on their terms, really, not on yours. And I think as parents, one of the things we do, we get home, don't we, from work and school, and then that's when we want to talk about things. We want to know how the day's gone, what's going on. And actually, it's the worst time for a lot of our children, especially as they become teenagers, because they don't want to talk about it now.
Absolutely.
My children always want to talk about everything just at bedtime. They become little philosophers at bedtime. Sometimes maybe not to go to bed, but I suppose that works on their terms. Yeah. Okay, thank you. I will pop out the call.
Thank you. So our next topic is eating disorders. And like Mrs. Hewitt stated at the beginning of the presentation there has been a huge increase in eating disorders being diagnosed across the world over the last 2 years. So an eating disorder is formed, or it's when eating, exercise, body weight or image become an unhealthy preoccupation in someone's life. There are different types of eating disorders. So we have anorexia nervosa, bulimia, binge eating disorder, and restrictive food intake disorder. It's important to know that they all have their own way of presenting. Some signs and symptoms that are similar across all of these eating disorders that we can look out for are a change in weight or physical appearance. Our children may become or adapt excessive exercise as part of their daily routine. We might see a change in eating habits, avoidant behaviors as well, particularly around meal times, excessive thoughts related to food and diet, and of course, distorted body image as well. So I won't talk too much about eating disorders because, as I highlight here, eating disorders require immediate specialist support. And it's important that support is sought immediately. There is a specialist eating disorder clinic at the Maudsley Hospital, which we're very lucky to have here in Abu Dhabi. And their team includes a dietitian, nutritionist, psychiatrist, and a therapist. And we have had personal recommendations from parents within our community who have dealt with this difficult issue, and they have sought the help at the Maudsley and have highly recommended it. I'd also just be mindful that we do show compassion, and we show that we care to our children who may be encountering this difficulty. So if they are willing to talk to you, listen without judgment. No matter how out of touch it may sound, just make it clear that you care, that you believe in them, and that you will be there whenever, in whatever way they need, whenever they're ready. You can see here on the slide that we do have the contact details for the Maudsley there, so please do be mindful to seek specialist support. Was there any questions regarding eating disorders, Mrs. Hewitt? Has anyone got any questions there?
We do have one. My daughter has reported that her friend isn't eating lunch. I know this is more about another child. What should she do?
Yeah.
What would you recommend?
So well done for the friend noticing these things. It's important to have these important friends in our life. If it's appropriate, if it's suitable, your daughter, the daughter could always approach the friend and express that they are concerned for them and that they've noticed they haven't been eating as much, and see if that conversation is something that will open up. I'd also advise your daughter to encourage the friend to speak to an adult or someone they trust. However, I do understand that with eating disorders, our children may not always be willing to get that support, in which case I would advise your daughter to inform a responsible adult or someone that they trust, just so they can raise the concerns. And then the staff member can take the appropriate steps to monitor or intervene. I do know that one thing that we do see quite often is children are concerned that their friend will find out that they were told on. However, I'd just like to reassure that here at Cranley and in schools, of course, we do have ways to maintain anonymity for whoever has disclosed the concern. But it is important that an adult is aware of the situation.
Yeah, it's a really tricky area, isn't it? Because the right thing to do is always to let an adult know. And I think it's a case of telling our students and our children that even if that means that adults do become involved, it's still the right thing to do. And I know that can make things difficult sometimes between friendship groups. But actually, if they do feel that there is a risk of harm or anything like that to one of their friends, the right thing to do is always to let an adult know. Okay, thank you.
Thank you. So moving on from eating disorders, we will now look at self-harm. So self-harm is causing intentional harm to your own body. It's often done to express emotions, and it's an unhealthy coping mechanism. Examples of self-harm include cutting oneself. We often see this on our wrists, forearms, upper thighs, and ankles. Burning is also another example of self-harm, and any repetitive behaviors to cause harm, so such as persistent scratching to cause physical pain. We also see twanging of elastic bands is another common one to look out for, where it causes welts around the wrists. Of course, some signs and symptoms to look out for are marks on the body, and quite often they are unexplainable but explained. So with that, I mean, we may have a student who presents with a mark on their body, and we ask how it happened, and there's an excuse for it. So they have a cat and the cat scratched them. And then a couple of weeks later, there's another mark on their body, and they had a shaving accident. And a couple of weeks later, they slid and hurt themselves on a tile. So quite often they do have excuses for these marks, but I think there becomes a point where we have to say, okay, that's one too many excuses there, and it certainly does need to be looked into. Another sign to look out for with self-harm is hiding body parts. And so with that, what it looks like is we might see our students always wearing jumpers or cardigans or like tracksuit bottoms, long pants. Of course, on that note, please don't be alarmed if if your child does wear a jumper every day to work, but it's usually more unexplainable situations. So, if they go out to the beach and they just want to sit in a hoodie, for example, then that could be a sign to look out for. Some support strategies when it comes to self-harm is firstly, like eating disorders, do seek specialist help. And this includes addressing any medical need for aid. So if there is a medical reason or medical need to seek support for the wound. Of course, as always, show compassion, be non-judgmental, and offer support. Tell them that you are there for them. And I understand that this is probably one of the more difficult ones for parents to understand. And it's important for parents to be non-judgmental and jump to conclusions such as, my child hurt themselves, it must be with the intent of wanting to end their own life. This isn't always the case. Quite often with self-harm, it is a cry for help. And it's important for us to remain calm and non-judgmental when we discover these things or these things are disclosed to us. Again, this is something I have heard from parents. It's just very hard for them to grasp how their child can hurt themselves. This is probably definitely one of the most difficult ones I think parents have to deal with. However, there is certainly support in place. There are a number of professionals across the Emirate who deal with self-harm and can support your child and family during these hard times. I will ask now if we have any questions relating to self-harm, just so we can keep up to date with the questions. Miss Hewitt, if we had any.
We don't have any about self-harm specifically. We do have some more questions coming through, so I will ask you at the end, Tori.
Perfect. Thank you. Do keep them coming. Right. So Sorry,
can I just interrupt? Sorry, Tori. The email actually doesn't have a dot. So if you just email lhewitt@cranley.ae, it's not l.hewitt. So apologies for that. We do have questions coming through on the chat as well, but it's lhewitt@cranley.ae. Thank you.
So I've now shared with you a few mental health challenges that we are seeing in school, so depression, anxiety, eating disorders, and self-harm, and how they're presented in different ways. I will now move on to talk about some factors that affect our mental health. Here we go. So, I'll start off by saying sleep, diet, and exercise all contribute to our mood and emotional well-being. And I'm sure there's probably some tips in this that we as parents and adults can practice as well as our children. So with our sleep, if we start with sleep, of course, ensure and encourage your child to go to bed at an appropriate time and ensure the bedroom environment is optimal. So unfortunately, this might mean removing televisions or leaving phones in the other room, keeping a tidy space, ensuring it's comfortable. With our younger children, it can quite often be practiced that bedrooms are kept for sleeping. So activities and toys are kept outside the bedroom. It helps them have that association that the bedroom is for sleep. If we are to look at diet, again, this should be adequate, which means eating in moderation. Of course, do allow your children and yourself to have some comfort food days, and of course, try get your 5 a day. Not only will this support your mental health, but it will, of course, support your physical health too. And I'm sure we are all aware of when we are in better physical health, we feel better mentally as well. Exercise, of course, this is a good way to let off some steam. And I'm sure we're all aware of the chemical reactions caused when we exercise. It increases our serotonin, our dopamine, and endorphins. And we know that these are affected in people who have depression and anxiety. Exercise is also a very good distraction, and being outside itself just helps hugely. For those less active things, it can be as simple as walking the family dog, or doing things like meditation, which can teach self-regulation. We look at self-care. Make it daily practice. I say make it daily practice. I think if that's one thing I encourage you to take away about self-care is to make it daily practice. And I say that because I always say, think of it like a plant. So if you have a plant that is withering and it's brown and its leaves are dying, if you suddenly water it and give it the nutrients, it will be very hard to bring it back. However, if you water it every day, if you nurture it every day just for a little bit, then over time that will have a positive impact. So I'll say just nourish in small ways every single day. Take 20 minutes or more to do something that you need to do to make you thrive. And another way to think of it is when we're on a plane, we're always told to put our mask on before we help others. And it's the same for self-care, but it shouldn't just be used in emergencies. It should be something we practice on a daily basis. I'll just go back to our work and social life balance. Do your schoolwork, but by all means do take time for yourself as well. So like us as adults, if we had to work all the time and spend little time socializing, we would probably be quite stressed. So encourage your child to have time for themselves. Encourage them to have time with others, even if this means arranging activities for them if they're not able to do that themselves. With our older children, and our younger children, of course, it's understandable that we want them to succeed academically, but pushing them to the extent they feel they have no other time is not beneficial for their mental health in the long run. A happy mind will be a happy learner. So we do need to be in the right mindset to succeed academically. Before I move on to our next slide, if there was any comments about those factors that affect our mental health, do let me know. Of course, there are a number of things that affect our mental health. However, these are just some of the ones that I picked because they are quite often overlooked. These are aspects that are in our daily lives: exercise and sleep and self-care, and the impact they have on our mental health is huge. It's huge. So by taking changes in these factors can have a positive outcome.
Hi, Tori. No, we've no questions about those specifically.
Thank you. So I will now move on to what is counselling. So this slide here can perhaps be linked to last year's Smash the Stigma. Quite often I have parents presume that when I see a student, I'm going to deliver an intense crash course of therapy where I delve into their psyche. That is not the case. Counselling is a collaborative effort between the two people involved. It is solution focused at overcoming problems that are causing turmoil, emotional distress, and it's used to identify goals. In some cases, direct one-on-one work may not be required, and it might be more of a case where I offer advice to teachers regarding strategies that they can adopt within the classroom. It might be advice to parents on what they can do in the home. On that note, some strategies that I apply in my office can easily be applied within your own home as well to offer that holistic support to our children. So I will share with you now some aspects that you can try practice. Firstly is unconditional positive regard. And this can be adopted in many ways. So for example, suspended judgment. I must refrain from using my own judgment and accept the students regardless of what they say. I provide them with that safe space where they know that information is kept confidential. And this is important, as if your child shares something with you that is personal, they want to know that you won't go tell their sibling, you won't go tell the neighborhood, or share it with other mums and dads that you speak to. Of course, being compassionate and understanding of their struggles is another way to demonstrate this unconditional positive regard. Another thing that I practice, and I believe that you could probably practice as well, is taking one challenge at a time. So it's important in therapy to focus and address individual issues one at a time and give each the attention they need on their own. So, for example, if you were to start associating negative thoughts with something, your body's natural response is to avoid it. So let's say due to the pandemic, you started to feel anxious about being in crowded spaces. You then start to isolate yourself from peers. This caused you to lack self-confidence, and this brought on low mood. When you start to avoid things, your life shrinks. And so we need to try take it back. However, if you try take it all back at once, you're more likely to feel overwhelmed and give up. So instead, you take the things that feel most manageable and work towards it. So you're not flooding yourself with these intense feelings, but you're taking your life back layer by layer. Another aspect of counselling is identifying and validating emotions. This isn't something that is quickly done, but it is easily done in terms of parents learning this skill. Some things that you can say is, Tori feels angry because you took her toy. I feel stressed because I had a busy day. Or, oh no, that boy hurt himself and is sad. There are so many ways that you can promote expressing feelings. There are movies to watch with our younger children. We can do a running commentary to something, talking about how people are feeling. For our parents with younger children, start now. This will just equip them with the skills that they need to be able to label their emotions and identify them. And then we can learn how to deal with them if they know what they're feeling. Lastly, it doesn't matter how they say they feel. They need you to be non-judgmental and respect that how they are or what they say they are feeling is how they are feeling in that moment. So don't just validate that. Next, we have talking about solutions and not always solving their problems, which I know is something that some parents find very difficult, because naturally we want to jump in and support our children as much as we can. So if our child is having difficulties within their friendship group, it's quite easy for us to say, oh, I'll go talk to their mum and get involved. However, in therapy, it is important to talk about solutions, give them autonomy over what happens. Of course, we all know that our kids love controlling things themselves. When talking about solutions, it's often quite helpful to talk about what worked last time. So come up with hypothetical solutions, discuss best and worst case scenarios. This can be adapted to all aspects of life, where they learn how to think about consequences. So what happens if you don't pick up your toy? You might step on it and hurt yourself. Or how will you feel if you don't have lunch? You might feel hungry and get tired. These types of conversations, again, encourage word use of emotions, which goes back to giving them skills to identify and label them. But it also helps them develop the skills that they need to be able to apply in future situations when they do encounter these difficult moments. Don't always be the savior. Help them learn the skills to have the ability to problem solve themselves. And I've just made a little note here. Counselling, or when a student is referred to me, it may not be one-to-one counselling that is required. It might be classroom interventions and support strategies in the home that I help facilitate. Now, like I mentioned earlier, I was just going to touch on some tips for effective communication with our children. And now I did a brief topic similar to this with our sixth form and GCSE parents not too long ago. However, I have adapted it a little bit more, so it's more suitable for all ages as well. I was actually going to title this page "Effective Ways to Talk to Your Children." But then I reminded myself that communication isn't just through talking, and that we don't just need to discuss our problems with each other. It includes the social communication, the smiles, the laughter, doing a family trip that they love and we can get that response, engaging in family activities, taking time to do things that they enjoy, even if it's something such as sitting quietly doing crochet. Communication also means physical communication, and that contact, a pat on the back or a hug, no matter how old our children, reassures that emotional security. I know we probably have some parents saying, my teenager would not let me hug them. But if you do manage to get that in there, I can assure you that it will be appreciated by them. So I'm now going to finally touch on some tips for effective communication. And again, I cannot stress the benefits by incorporating meaningful conversations in daily life with your child. For our little ones, it allows them to learn how to communicate their big emotions, as we call them. With our older ones, it gives them an understanding adult to share their story. I often use the Chinese finger trap as a way to describe the importance of this. So with the Chinese finger trap, our response is to pull away. But when we do this, the trap tightens its grip. And the same applies for emotional pain. If we feel anxious, we run and avoid it. If we're depressed, we resort to what safety behaviors we know. However, by doing that, those emotions just take a tighter grip on us. And our decisions are based on how we feel at that time and not our values. When we are willing to face those emotions and talk and communicate about how we feel and be in that space, so moving our fingers closer, we get a bit of wiggle room. And then in that wiggle room, we can make choices to improve our situation. All of our children want to be heard. So make it known that you are there to talk about the good stuff and the bad stuff. Daily check-ins are a great way to allow your children to express how they feel. It also normalizes emotions being talked about and helps you learn them better, so that when something is off, it's easier for you to pick up on it. I'll also just mention that it's important to be an active listener as well, and to show them compassion and genuine concern for their thoughts and feelings. Validate what they are saying. So this can literally look like you saying, I understand you are sad. Your brother took your toy away because he wanted to play with it. Again, it goes back to labeling those emotions and telling them that how they feel is valid and there's nothing wrong with that. I will come to a close now. I know we have some questions to address, and Mrs. Hewitt has some final words as well. However, I'd like to leave with a reminder that next Thursday we will be celebrating World Mental Health Day here at Cranley. We will have some silly, some fun and happy small activities happening around the school. And I can guarantee, I know now, that it will get students smiling. Now, this just goes to show that small, simple acts can have that positive impact. And if we try and incorporate them into aspects of our day, then I'm sure we will see great change in our children's mental health. I will go back to our questions and comments, and if there was anything there, I will be happy to answer them now.
Thank you, Tori. That was wonderful. And I definitely have learned some things just from listening to you talking about, particularly things about like hiding behind the masks and not always being the saviour when it comes to our children. That really resonates with me as well as a parent. Just a couple of questions that we have. How can I help a younger child who's biting fingernails, which is a sign of anxiety? The child seems happy and active in other ways, but this is like an ongoing issue. Have you got any advice?
Yeah, certainly. So, like we've discussed, anxiety does manifest itself in a number of ways. And yes, nail biting is a common one across the younger years. Certainly do try address the underlying cause of the nail biting. If we can try figure out what it is that's making them feel so anxious, then we can try work on this. It might be helpful to keep a mental note of when you notice them biting their nails. Is it always in the mornings before they go to school? Is it during a particular activity they do, for example? Hopefully by being able to establish when they find the need to do this behavior, we can identify the root cause of it. And then that opens up the opportunity to work with that and overcome the anxiety that's underlying it. I do know that working with the behavioural side of it as well is something that a lot of parents try work with as well. And that can, depending on the families, it can include things like putting on paste and taste things that taste quite yucky to try break that habit as well. But definitely I would say try address the underlying issue and work with the anxiety that's perhaps driving that behaviour.
That's a great tip. Another question that's come through is how do students get to see Tori? And I think I can partly answer that one as well. So our senior students do have the option to self-refer to Tori, and often referrals are made by our staff who are working closest with them. In prep and pre-prep, the referral process is in collaboration with parents. If a member of staff or if you as a parent want to have your children see Tori, then obviously that is something that we work together to provide, and that would mean that you would fill in some forms as a parent and that you would give your consent as well, and that, like I say, it's about that triangle of working together. That is it for the questions. There's just one more just come through. Is it possible to have a copy of the presentation? So as we did last time, we will PDF that and put that onto our newsletter tomorrow. So thank you for that. It is a great question. I know sometimes you want to go back, and again, the live recording of this will be added onto the newsletter as well. I would just like to say thank you to Tori. I know you are working really, really hard with many of our students right now. For our parents, I also wanted to say that whilst it seems like this is a global problem, there is good news as well. So I mentioned before the NHS digital survey. It also showed that over the same period of time, between 6 to 16-year-olds, 22% saw an improvement in their mental health. And that was the same for 17 to 23-year-olds, 15% saw an improvement in their mental health. So it is not all doom and gloom. We are here as a community to support each other. And our theme for World Mental Health Day this year is I don't mind. And that's followed by a number of statements. I don't mind listening to you. I don't mind supporting you. I don't mind if you put your mental health first. And that's something that we strongly believe in here at Cranleigh. And we don't mind listening to you either. So if you do have any questions that we can help you with, if you want to email myself, we're always here for you as a sense of, to support you as well as parents. So I will end it there, and I will say thank you again to Tori for all of your hard work and all of your useful help. And thank you to Angela, who's been in the background making sure that all our questions are answered. And I would say thank you to you as well, to our parents, for always supporting our children and always supporting our staff in allowing us to be such a warm and helpful community. Thank you.